give you an example. Well, we've been talking about what the health service can do to mitigate the inequity. People from the most deprived get less, let's call it high-tech healthcare, than those from the least deprived. So that's one aspect. The second approach is to think, this is what we remember, there's four aspects of value: personal value, allocative value, technical value, which is much broader than efficiency, and social value. And this was introduced when I was working with the European Union in those good old days, when we developed the EU policy on value, which is now owned by the G20 as well. And social value was added there. There's people from the Netherlands and other places. Now, what do we mean by social value? Well, I'll give you an example. Where I was working many years ago in sustainable healthcare, and we run one part of the country where we got the local farmers to get together and to offer a food service to the local hospital. That was all going very well until suddenly, I don't know how it happened, I took my eye off the ball, or thought I had more power than I had. The contract was let to a multinational bring in frozen food from Eastern Europe, which was cheaper year one, but I'm sure went up. So that was an example of social value. How can a health service encourage local businesses? How can a health service, and this when I worked I was advising with Jonathan Gray when he set up his centre in New Zealand, they specifically tried to recruit nursing and medical students from the Pacific Island populations, Maori populations. So there's another example of creating value. And the NHS Confederation published a report on value which talked about the benefits from stimulating the local environment. So that's one thing. I think we can relate to the local environment in a much more thoughtful way.